All right, that's great. I'm going to talk to you specifically, but also to those of you who, secondarily, to those who have systems of care that ultimately touch patients. As health professionals, you and me, we're all interested in having people be healthy and stay healthy. And many people assume incorrectly that all of health arises from health care itself, from the clinic. And that's not true. There's an awful lot that can happen in the clinic, but there's much that can be done outside of clinics. And what I see our primary responsibility at the health department is to do what we can to make the environment outside of clinics to be promoting of health. As Joe said, to make the healthy choice the easy choice. So we work outside the clinic, you work inside the clinic, and I want to talk about how we can work together to achieve what I think are the biggest strides in health. So first let me just say, ask the question, what does determine how healthy we are? You know, we live in an era where the primary killers are chronic diseases like heart disease and cancer and diabetes, and injuries, like those from homicide and suicide and accidents. That may seem like the natural way of things, but it wasn't always the case. 150 years ago, our leading cause of death were entirely different. They were infectious diseases, like cholera and yellow fever. So this is unique to our era. How do we deal with this problem? First, we should recognize that those diseases, for the most part, are not curable. They're treatable, but not curable. So we don't cure heart disease for the most part. We don't cure homicide for sure. We don't cure diabetes. We can treat it. But we can prevent those, and the best way to prevent those in general is by having people adopt healthy behaviors. And most people know what healthy behaviors are, but the ones that are the most important to health these days, in about this order, are lack of smoking, having a healthy diet, being physically active, not having binge drinking, and I'm going to talk more about that later. And so I'm going to talk about those, and I'm also going to, and I will mention that injuries is part of this too. I'm going to talk about those behaviors, and I'm also going to talk about teen pregnancy, because that's something that really concerns me, and I think we have an opportunity to do better on that. So first, some statistics on these behaviors that matter so much, and I'm going to focus on Hispanics in particular. So in smoking, Hispanics have rates that are higher than the city as a whole. We have smoking rates that are about as low as any community in the nation. I think a large part to work of this health department before my time. About 14%. Among Hispanics, it's 16% that smoke, that's adults. Obesity. Rates are higher in Hispanics than there are in other populations. 30% of Hispanics are obese versus 17% of non-Hispanic whites. Big difference. Physical activity. Hispanics are less physically active, according to our survey, than other ethnic groups. 68% say that they have had some sort of exercise in the last 30 days versus 77% of non-Hispanic whites. Now, alcohol consumption, Hispanics, or actually what we would define as heavy alcohol use, Hispanics are healthier than the rest of the country, than the rest of the ethnic groups. We have 3.8% heavy alcohol consumption versus roughly 3 times that among whites. Now, teen pregnancy is a particular issue. Teen pregnancy among non-Hispanic whites in New York City, 19 per 1,000. Among Hispanics, 93 per 1,000. So about 4 to 5 times higher. Okay, so that's the news, okay, good and bad. Let's talk about what we are doing about it and what you can do about it and how we can work together. Let's talk about smoking first. In smoking, we are doing everything we can to make the environment outside of New York City less supportive of smoking and more supportive of people who want to quit. So we have smoke-free bars and restaurants. We now have smoke-free parks and beaches. We have, soon we'll have an entire smoke-free campus at CUNY. We have very high taxes on cigarettes. A pack of cigarettes, in case you're not a smoker, you don't know this, it's $11 in New York City, the highest in the nation. And we run some pretty tough ads on television that warn people about the risks of smoking. That has brought our smoking rates down. During this administration, smoking rates have fallen from 21% to 14%. Just so you know, that's 450,000 fewer smokers than when we came in. and it's already saving about 1,500 lives per year. So, okay, but there's an opportunity missed here, and that is when people come in contact with the healthcare system who smoke, in general, they're not getting counseled by the healthcare providers to quit. Now, overall, it looks like about 20% or less of smokers are counseled by their healthcare providers to quit. And I can understand why healthcare providers might not bother, because it seems like nobody listens to you when you tell them to quit. But you know what? It's well shown that they're about twice as likely to quit if you counsel them to than if you don't. So even though you'll fail most of the time, a simple message that you should quit over time can make a big difference citywide. So ask if people are smoking and recommend that they quit. Now let's talk about diet. What are we doing on diet in the health department? Well, a lot of things, some of which are related to obesity and some that aren't. First of all, we got rid of trans fat in the city's restaurants, which was something very controversial. Thank you. It was something very controversial at the time. You know, how dare you take away my French fries, was the media we got. Sort of reminiscent of what some of the messages we're getting these days. But you know, I've been health commissioner for 3 years. No one has yet come up to me and said, please put trans fat back in my food. Hasn't happened, and I don't think it will. We've put the calorie counts on the menu boards. That may be considered bad news for some of you, but it does work for some. And because hypertension is such a problem, we are working with the food industry to lower the sodium content in packaged food and restaurant food. Thank you. What we did is we worked with the food industry, divided up food into 62 categories for packaged food, 25 for restaurant food, and within each category, we've given the food industry targets of how much to reduce that over 5 years, and we've challenged them to commit to meeting those targets. And we'll be later this year finding out whether they've been able to make the first step towards that through 2012. And then there's sugary drinks. As you know, we have talked a lot about sugary drinks. And the reason we care so much about this is that although they are not the entire obesity epidemic, they are probably the largest single driver of the obesity epidemic. From the 1970s to about 2000, consumption tripled in America to where it got to be about the average person taking about 200 calories per day in the form of sugary drinks. And if you're talking about minority teenagers, it was probably 2 to 3 times that. So hundreds of calories per day, and they're particularly associated with weight gain. So we've focused a lot on sugary drinks, and sugary drink consumption has gone down in New York City from about 10% over the last few years. So we're moving in the right direction. And of course we have our new portion rule, which we're excited about. You know, and now that's not the only contributor to the obesity epidemic. We also, I would say the next on our list of concerns would be the salty snacks, the chips. It's so easy to take in an awful lot of calories in a short period of time. So what can those of you who are healthcare providers do about that? Well, you know, nutrition is really complicated. It's easy to get overly lost in the details. I would suggest every time you see a patient, you give them a very simple message. No sugary drinks, no chips, more fruits and vegetables. That takes about 10 seconds to say. If you say that every time, people will get the message. And that will address probably our most important dietary problems. No sugary drinks, no chips, more fruits and vegetables. Let me say, there is good news on diet in New York City. In case you didn't see the news, childhood obesity in New York City has gone down about 5% over the last 4 years, as measured in the state. So something that we all together are doing is working, and I'm really excited about that. We've got a long way to go, but I do think that we're finally starting to see it turn in the right direction. I'm going to talk about physical activity. Most people get most of their exercise, if we call it that, in the form of transportation. It's not going to the gym, it's just getting around. And if you think about our grandparents, they were a lot more physically active than we are, and they never went to the gym. Okay, they got it because they had to do it at the job, they had to be physically active to get around. And so a lot of our focus is trying to take the fact that we've engineered physical activity out of our lives and engineer physical activity back in our lives. To put in things like bike lanes and pedestrian plazas, and open up the stairways in buildings so people can get around, making general environments so it's more promoting physical activity. We'll put a parks and playgrounds within a 10-minute walk of everybody. That's a goal of the city. But now what can healthcare professionals do? Well, there's not a lot of good research on this, but it seems like the parallels to the other ought to make sense. That simply recommending that your patients get exercise all the time. It's an easy thing to forget, but by the same token, it's easy to remember. Now, some people have actually recommended that doctors write prescriptions for exercise, in the same way you write a prescription for taking a pill. And when you think about it, exercise prevents heart disease, stroke, hypertension, obesity, diabetes, depression, osteoporosis. Going down the list, if that were a pill that I invented, I'd get the Nobel Prize. So it makes sense to prescribe that, and I don't know if it works, but it certainly is worth a try. Let's talk about alcohol for a minute. You know, we're all enjoying our wine here tonight. It's pretty good evidence that 1 drink a day is probably good for you, okay? But more than 5 drinks a day is definitely bad for you, all right? And that's binge drinking, and that's what we do need to stop. If you, in fact, injuries are among our leading killers. Across the board, about 30 to 40% of injuries are in people who are under the influence of alcohol. Whether you're talking about homicide, suicide, or people getting depressed under the influence, or of course, injury, or accidents, okay? Not just cars, but falls, all sorts of injuries. So we need to try to reduce rates of binge drinking. You may have seen some of the ads we have on the subway, in English and Spanish, by the way, that the 2 drinks ago you would have, and they talk about the things you could prevent if you didn't have those extra drinks. So what can you do about it? Those of you who are seeing patients, there's an established procedure, if you haven't heard of it, called screening, brief intervention, referral, and treatment, or SBIRT, for alcohol consumption. We ask a couple of questions. You find out if people are having problem drinking. You give them some simple advice if they're having some level of problem, or if it's a more severe problem, you can refer them for more treatment. It's proven to work. It doesn't take long to do. It can prevent an awful lot of problems down the line, and you can do it and I can't. And so that's a key piece to our addressing the alcohol problem. Let me talk about teen pregnancy for a second. The good news is that, let's talk about teen sexual activity. It's a little higher in Hispanic teens than other teens. The good news is it's going down, but still, there are plenty of teens who are sexually active, and Hispanic teens particularly are not likely to use contraception. And they come in contact with the healthcare system, and they're often not getting identified as being sexually active and not getting contraception. So, and I'll be the first to confess, I'm a pediatrician. I went through my entire training, and I probably did 2 pelvic exams, and I have never written a prescription for oral contraceptives. So that's one thing we need to fix, because teenagers see pediatricians. So we need to put contraception where our teenagers are going. Now there's also what sort of contraception works. There's a study that just came out that shows that long-acting reversible contraception, that is IUDs, and Depo-Provera are 20 times as effective as pills in kids, because kids don't remember to take the pills. So there's plenty of opportunity for us to prevent an awful lot of teen pregnancy, the teens who don't want to be pregnant and whose lives are interrupted in a very unhelpful way if they become pregnant. So let me put all this in part of general principles, that you are there as medical professionals, you have an opportunity to give advice, and so give advice. I call this policy, do ask, do tell. And what that means is ask your patients about their behaviors that matter most, and there's only a few of them, and then tell them what they should do. You are the expert, you are the one that's providing them the services, you are the one that they will listen to more than anyone. Don't hesitate to tell them what they should do in order to stay healthy. And keep at it. Don't be discouraged if they don't listen to you the first time, because it often takes many times to get the message, but they'll certainly get it a lot more if you talk to them than if you don't talk to them. So, to get back to my original point, health in our era, this era of chronic diseases and injuries, is mostly about behavior. And our healthy behavior is about the environment we live in and the cues we get every day. And so you can be part of this with us to make this the healthiest city in America, the healthiest city on earth. So I ask two things. First of all, when we at the health department do something controversial, not that we ever do that, please support us, because your voice as health professionals really makes a difference. And second of all, support your patients whenever you see them by reinforcing those behaviors that matter most. And if you do that, I do think we can be the biggest, the healthiest, we are the biggest, we can be the healthiest city in America. And that, I think, would be a great legacy for all of our children. Thank you very much.
Dr. Foley, thank you very much for being with us here tonight. We're honored that you took some time out of your very busy schedule as New York City Health Commissioner to address our group on a topic that's extremely important to our community. But we also want to take this opportunity to recognize your contribution and to award you this evening with our first Health Advocate of the Year award. And I'm going to have our GALA chair read the inscription.
Health Advocate of the Year and keynote speaker Thomas A. Farley, MD, MPH. What does that mean, George?
Master of Public Health.
I should know that, right? Commissioner, New York City Department of Health and Mental Health. Leaders, Events, and Health Equity, 12th Annual Healthcare Diversity Awards, New York Academy of Medicine, June 20th, 2012. Congratulations, and thank you for the great work.
Unfortunately, the Commissioner, because of his heavy schedule, does have to leave us tonight. But I promised him that I would send him a link to a video that our Hispanic Marketing Company of the Year is going to be doing and presenting to us to address, that's going to be looking at how do we motivate young Latinos to address the issue of obesity, and using it in a language, in a culturally competent setting that will be pertinent to how they react to health communication messages. So we'll make sure that your office sees that. I'm very proud that we have someone in our community that's able to convey this kind of message, because one thing we want to make sure is that we effectively communicate health information to our community. And it's from individuals that live and work in the community that can more effectively do that. So thank you very much for being here tonight.
Great. Thank you.
I have to add that I think he gives Mayor Bloomberg Spanish a run for its money, if you ask me. Pretty good, don't you think? Pretty good. And you know, I joked recently on the news, there was a study that came out that talked about the national average for how long people live across the country, and we are beating that national average. So I joked, you know, you want to live longer? Come to New York. I couldn't say that when I was growing up, I don't think. I can say it now and feel pretty good about it. All right, we want to continue to celebrate everybody that's here and put that shout out I talked about for all the hard work. And I want to bring up right now Miguel Centeno, Managing Director of Community Relations and Urban Marketing at Aetna, to make some more remarks. He's our national partner. Come on up.
Muy buenas noches. Good evening. And let me just say, Dr. Farley, tu español es mucho mejor que el del alcalde. Your Spanish is much better than the mayor's. It is indeed a pleasure to be here this evening, very much a pleasure to be back as a national partner of AHES. We have been at this now for several years because we very strongly believe in AHE's mission. It very much is in line with what we believe as a company, and I'll touch on that in a moment. But before I go any further, I definitely do want to acknowledge two of my Aetna colleagues who are here with me this evening. And since ladies always come first, I will start with Dina Segro Noguera. For her day job, Dina does many things to ensure Aetna's success. But with regard to AHE in particular, she has been involved with this organization now for several years. And recently she decided to step up with regard to her efforts with AHE. And she joined AHE's board of directors. And so I know that she played an instrumental role in the planning and the success of this event and also many other activities throughout the year. And so please join me in thanking Dina for her hard work. And I also want to acknowledge my community relations colleague, Raymond Arroyo. Many of you in this room know Raymond. He has been with Aetna for some time, but most recently, only recently, joined community relations, and we are very thrilled to have him be a part of our team. And if you don't know him, make sure, take a look, get to know him, because he will be playing an increasingly important role, a more visible role, with regard to our partnership with AHE. So again, Raymond, welcome to the team. Let me also congratulate tonight's well-deserving honorees. You all have achieved incredible things, and you very much deserve the recognition that you are getting this evening. Let me, at this time, congratulate George Zeppenfeld, Luis Vasquez, and the GALA committee for selecting what I believe to be the perfect venue for this event. Now, we have been national partners now for about 5 years. And so we have been at many different venues for this event. We have been at the United